Shoulder pain is most commonly associated with injury to the muscles, tendons, and ligaments within the shoulder. However, this pain can also originate from the area of the cervical spine and radiate from the neck down into the arm. There are two main joints within the shoulder, the acromioclavicular and the glenohumeral joints. The acromion and the clavicle combine to form the acromioclavicular or AC joint. The coracoid process is a thick, curved structure attached to the upper part of the scapula. The glenohumeral joint is a ball and socket joint which involves articulation between the head of the humerus and the glenoid fossa of the scapula. There are 5 major muscles of the shoulder joint responsible for movement of the shoulder. In the front portion of the shoulder, originating from the scapula, the muscles involved are the subscapularis and the biceps muscles. The supraspinatus is a relatively small muscle that runs from the top portion of the scapula, which inserts into the top of the humeral head. And from the back position, the muscles of the shoulder joint include the infraspinatus and the teres minor muscles. These muscles of the shoulder combine to form a thick cuff important in stabilizing the shoulder as well as elevating and rotating the arm. Elevation of the arm causes squeezing of the bursa located above the supraspinatus tendon and below the acromion. Bursitis is a frequent cause of shoulder pain and usually occurs in conjunction with an impingement syndrome. Irritation of this bursa will often cause pain due to overuse. Biceps tendinitis is a condition that affects the area where the biceps muscle meets the front of the shoulder. Tendinitis of the biceps usually develops as a result of rotator cuff tendinitis. Tears of the rotator cuff are a common cause of pain associated with the shoulder. Most tears occur in the supraspinatus muscle and can be either partial or complete, with complete tears of the tendon usually requiring surgery. The labrum is a cuff of tissue surrounding the rim of the glenoid, which helps keep the head of the humerus in place within the shoulder joint. Tears of the labrum are often associated with significant shoulder pathology. 2 of the most common types of labral injuries are the slap tear and the Bankart lesion. The slap tear occurs at the point where the tendon of the biceps muscle inserts on the labrum. And finally, the Bankart lesion occurs when an individual sustains a shoulder dislocation, which ultimately tears the labrum. The treatment of shoulder pain depends entirely on the cause of the problem. If you are unsure of the cause of your shoulder pain, or if you do not know the specific treatment recommendations for your condition, you should seek medical attention.